Hi, so today's question is regarding the management of oral-antral fistula. Now, given the options, first is observation. That is not a relevant option because if the communication is under 2 mm, it will close by its own. But if it is not, and if it is left just like that, it will lead to oral-antral fistula. And second option is the correct option that we will come back and I'll explain you that. C is fluoride varnish. That is irrelevant to this because fluoride varnish is basically used for prevention of dental caries. And the third one is just leave it as it is. No, that could be very dangerous. That is could lead to oral infections, sinusitis, and it could lead to oral-antral fistula formation. So that is highly not recommended at all. So we have ruled out the. Hi, now coming back to our option B, that is your surgical management and everything. So now that depends totally how big is the opening. If the opening is less than 2 mm, then it will heal by its own. We can just give a suture so a clot formation is there and healing will take place on its own with time. And then second, so in 2 to 5 mm opening, we give primary closures and sinus precaution is given so that the collagen plug could be formed. And now we also give some antibiotics, in this case antibiotics decongestions for respective 3 to 5 days. Now if the opening is more than 5 mm, that is a large defect is there, in that case we need immediate closure with flap. And the flaps are with buccal advancement, one palatal rotational flap, and third is buccal fat pad flap. Now after this we have to give same antibiotics, nasal decongestions, analgesics to patients for next 3 to 5 days. And after this is done, now we take follow-up from the patient after 48 to 72 hours. If the patient is doing fine, then we give the sinus precautions and everything for next 7 to 10 days and the patient is completely healed. Now in case of persistent leaks, what we do is that we give the flaps again so that there is no oral-antral fistula formations. And in case there is sinusitis now, then we have to refer the case to an ENT. So we have to manage it very properly depending upon the timings and then the follow-ups. So just keep those things in mind.